Hello, my name is Dr. Dewan S. Raja. Today I will discuss about lumbar, sacral, and pelvic splanchnic nerves. Let's start with lumbar splanchnic nerve, then we'll go to the sacral splanchnic nerve, then we'll go to the pelvic splanchnic nerves. The lumbar splanchnic nerves arise from the abdominal part of the sympathetic trunks. Medially, the lumbar sympathetic trunks gives of 3 to 4 lumbar splanchnic nerve. Lumbar splanchnic nerves pass to the intermesenteric, that is between the superior mesenteric and inferior mesenteric and superior hypogastric plexuses, conveying presynaptic sympathetic fibers to the associated prevertebral ganglia of those plexuses. So this is containing presynaptic sympathetic fiber and associated with prevertebral ganglia of those plexuses like the superior mesenteric plexus, inferior mesenteric plexus, intermesenteric plexus, hypogastric plexus, and we'll have the convey there. There will be postganglionic fiber arises from those plexus and the ganglias. The sacral splanchnic nerve carry preganglionic sympathetic nerve originate from the sacral sympathetic trunk destined for anterior rami forming sacral plexus. Okay, so you got lumbar and sacral splanchnic nerve. Will continue. The sacral splanchnic nerve are part of the autonomic nervous system and primarily consists of sympathetic fibers. They contribute to the autonomic control of pelvic organs and the lower part of the gastrointestinal and urogenital system. Anatomy and function of the sacral splanchnic nerve origin. The sacral splanchnic nerve originates from the sacral part of the sympathetic trunk, typically S1 to S5 ganglion. These fibers are preganglionic and postganglionic sympathetic fibers, along with some visceral efferent fibers. Okay, so if we look at that, we are looking here the gastrosplanchnic nerve coming from the thorax passing through the crus of the diaphragm will get the inferior mesenteric, superior mesenteric, intermesenteric plexuses. These are pre-aortic plexuses. We'll get the lumbar splanchnic nerve here going medially, and we'll get the sacral splanchnic nerve going to in this way, and we'll get also the pelvic splanchnic nerve. What will go? This is parasympathetic pelvic splanchnic nerve from S2, S3, S4 going to this plexus, inferior hypogastric plexus. Inferior hypogastric plexus is also receiving the sacral splanchnic nerves. Okay, and these are the lumbar splanchnic nerve going to these plexuses. From the lumbar part of the sympathetic chain of ganglion, we are getting lumbar splanchnic nerve. From the sacral part of the sympathetic chain of ganglion, we are getting the sacral splanchnic nerves. From the S2, S3, S4 segment of the spinal cord, we are getting the pelvic splanchnic nerve, and pelvic splanchnic nerve is a parasympathetic. It is parasympathetic, those nerves. Sacral splanchnic nerve pathway, the nerve exit the sacral sympathetic chain ganglia and pass towards the pelvic region. They join the inferior hypogastric plexus, pelvic plexus, where they interact with parasympathetic fiber from the pelvic splanchnic nerve. So there will be interaction between sympathetic and parasympathetic in the inferior hypogastric plexus. Innervation by sacral splanchnic nerve, sympathetic innervation to the pelvic viscera, including the bladder, rectum, and reproductive organs. They regulate smooth muscle contraction and glandular secretion in the pelvic region. Play a role in the vascular regulation of the pelvic organs. So, purpose is to regulate smooth muscle contraction and glandular secretion in the pelvic region. They regulate it. Okay. So, play a role in the vascular regulation of the pelvic organs. Sympathetic are usually vasoconstricted. Okay, if you look at this image again, we are looking at the sacral splanchnic nerve here. You will get the lumbar splanchnic nerve. Okay, inferior mesenteric ganglion. We have the superior mesenteric ganglion, intermesenteric plexus. So they are contributed by the lumbar splanchnic nerve, and the sacral splanchnic nerve will go to the pelvic region, along with the pelvic splanchnic nerve will provide the contribution to the hypogastric plexuses. The sacral splanchnic nerve, clinical relevance, autonomic dysfunction, damage to the sacral splanchnic nerve can result in autonomic dysregulation of pelvic organs, potentially leading to issues such as bladder dysfunction, sexual dysfunction, or bowel control problems. So, how we should differentiate sacral splanchnic nerve from pelvic splanchnic nerve? Differentiation from pelvic splanchnic nerve. The sacral splanchnic nerve carries sympathetic fibers, while pelvic splanchnic nerve are parasympathetic, originate from S2 to S4 spinal nerve roots. Pain transmission. The visceral afferent fibers of the sacral splanchnic nerve are involved in the transmission of pelvic pain, including referred pain from the pelvic organs. Now we'll go to the pelvic splanchnic nerve. The pelvic splanchnic nerves are parasympathetic nerves that originate from the sacral spinal cord S2 to S4 and play a crucial role in autonomic control of the pelvic organ. Origin arise from the ventral rami of spinal nerve S2, S3, S4, carry preganglionic parasympathetic fibers from the sacral parasympathetic nucleus in the spinal cord. Course and distribution travel through the inferior hypogastric plexus, supply parasympathetic innervation to the pelvic organ, bladder, rectum, and reproductive organs. Distal part of the colon, left 1/3 of transverse colon, particularly the splenic flexure, descending colon, sigmoid colon, and rectum. This is parasympathetic. Above that, the colon and the intestine, stomach will get innervation from the vagus nerve. Okay. So the pelvic splanchnic nerve, this is for the parasympathetic innervation of this part, the splenic flexure, descending colon, sigmoid colon, rectum, and upper part of anal canal. Okay, along with other pelvic viscera, including the reproductive organs. So the pelvic splanchnic nerve should come from S2, S3, S4. Sacral splanchnic nerve coming from the sacral segment of the sympathetic trunk. Okay, so from the S1 to S5 ganglion, if we have 5 ganglion, sometimes we may have 4 ganglion that contribute in the sacral splanchnic nerve. That should the original fiber should come from the L2 level because it is mostly sympathetic. Let's go to the pelvic splanchnic nerve again. Function, bladder micturition, stimulate detrusor muscle contraction. Detrusor muscles are smooth muscle in the wall of the urinary bladder. relaxes internal urethral sphincter, promoting urination. That is also a smooth muscle. Rectum defecation enhances peristalsis in the rectum, relaxes the internal anal sphincter to facilitate defecation. Sexual function controls vasodilation in the erectile tissue of the penis and clitoris, important for erection. Contributes to the ejaculatory reflex and vaginal lubrication. So these are the function of pelvic splanchnic nerve: sexual function, defecation, micturition. Gastrointestinal motility increases the colonic motility in the hindgut. So it increases peristalsis. In the splenic flexure, the sigmoid colon, the rectum. Clinical significance of pelvic splanchnic nerve: pelvic surgeries or injuries to the sacral spinal cord can damage this nerve, leading to urinary retention or incontinence, constipation, sexual dysfunction, erectile dysfunction in men, decreased vaginal lubrication in women. And that's all about the lumbar splanchnic nerve, sacral splanchnic nerve, and pelvic splanchnic nerve. If you have any question, please feel free to ask me. If you have any confusion, please do not hesitate to ask me. Please support my channel. Please share the information with your friends. And please subscribe me. Have a nice, wonderful, and blessed day. Bye now.